Hello, and welcome back to the Diverse Thinking, Different Learning podcast. I'm so glad that you are joining us today. Today, we are tackling the topic of teen depression. Depression among adolescents has been on the rise, and in today's digital age, new factors are shaping the way young people experience, express, and even seek help for their struggles. My guest today is Dr. Meredith Gansner, a child psychiatrist, researcher, and author of a new book, Teen Depression Gone Viral. Dr. Gansner is an instructor of psychiatry at Harvard Medical School and an attending child psychiatrist at Boston Children's Hospital. Her research focuses on high-risk digital media use in adolescents, and she has written extensively on how today's digital world impacts teen mental health. In her book, she discusses why kids are more vulnerable than ever, how depression manifests in adolescence, and how parents can protect their children's well-being. I am so glad to have her joining us today.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hello, Dr. Gansner. Welcome to the podcast.
Hi, thank you so much for having me on.
I appreciate you joining us. And in the intro, I mentioned your book, Teen Depression Gone Viral. And first, thank you for writing it. It is such a valuable resource for clinicians, parents, educators. And just out of curiosity, what prompted you to write it? And it just seems like it's the perfect timing for this to be out there.
Thank you. I admittedly had been, maybe not pondering writing a book specifically, but have been putting together my thoughts about the relationship between mental health and youth using digital media and social media for years. And I started out about 10 years ago, maybe a little more than that, feeling incredibly optimistic about how we could tackle this problem as clinicians and as scientists, and thinking we have so many passionate people who are working on this topic, and they're going to figure out exactly how we can, in real time, protect our children from potential dangers that are online, while also really encouraging the benefits of this expansive online world that can connect youth, especially marginalized youth, to other people like them. So I was really very optimistic. And unfortunately, as time went on and the internet and social media kept evolving, science still kind of stayed pretty much at the same pace. Kind of, is depression, is anxiety, is it really being caused by social media platforms? Is it actually the fact that when youth use digital media, they're not sleeping as much or not going outside? And I think these are all very important questions to ask as scientists. But because these platforms were evolving so quickly, clinicians, and in my clinical work, were feeling incredibly frustrated because we weren't making any meaningful improvements in helping the people who actually see the children know how to manage difficult issues like cyberbullying or children that look at suicide-related content online. And so in my clinical work, especially during COVID, where I worked on an inpatient unit, I was seeing so many parents come in who were overwhelmed, just absolutely overwhelmed, because right during those lockdowns, they were trying to work from home while keeping their kids safe online. Their kids were trying to do remote schooling, but were miserable. And I realized at that point, we as the scientific community, and I think as clinicians, we're unintentionally doing a disservice to all of these families. And what they really needed was an understanding that this isn't their fault. They're doing nothing wrong. This was COVID especially was an incredibly challenging situation. But even just the fact that we released all of these technologies into the world, and weren't able to tell parents, hey, when your children get a hold of these, this could be really risky. I mean, parents were already, trying to catch up. So it's not their fault. They should try as much as they can, offer themselves some grace. However, I also wanted to provide concrete information to parents too, so that they can realize that, for them, the internet can also be a place of great benefit in connecting with other parents who may also have children struggling with depression or other psychiatric disorders. But it's also a place where you can get very inaccurate information. And so I felt this might be a good opportunity to help both parents and their children figure out the ills of the internet and the benefits of the internet in this day and age, and how that can impact treatment of depression. It can impact the diagnosis of depression, whether or not a child accepts that they even are depressed. And so that was the kind of long story of how this book came to be over the course of many years.
Yes. And, you mentioned COVID, and that was absolutely a challenging time. We saw the youth mental health crisis, really reach a pinnacle at that point. And we're still kind of figuring our way through the crisis. It's definitely hasn't disappeared. You focus on depression in your book. Can you talk to our listeners about kind of what depression is and how it presents in teenagers?
Yeah. So depression, we know first, it's a real illness. It isn't just sort of an issue with the way a person is thinking. It can impact the way that a person is thinking. Absolutely. But it is a real physiological illness, and there are real changes in the body that occur. We know that there is an increased kind of rate of inflammation when someone is depressed. We have some idea of the chemicals in the body, known as neurotransmitters, that may be involved in depression. But admittedly, again, this is where science sort of falls a bit flat. We don't 100% know all the different mechanistic pathways inside the body that create depression. But, and this is both a good and a bad, we do know that there are many different risk factors that can lead to depression, which that part's not great. So there are a lot of things that can contribute to depression, medical illnesses, substance use, stressors for children, right? A parental divorce, early life stressors, a family history. There are many different factors, right? But good news is that because there are so many factors, you actually need a fair number of them to sort of come together in a perfect storm to create an episode of depression. And so that means that it isn't just one single factor like social media or, parents and children having a conflictual relationship. That alone is not enough to bring about a depressive episode. And so I think that is, relieving and encouraging to many parents, or it should be, because many parents do tend to blame themselves sometimes.
It is encouraging.
Just in terms of your second question, I think that's an excellent question to ask, because many parents will say to me, but my child doesn't look depressed. I think many adults, when they think of depression, think of Eeyore and Winnie the Pooh, the very sad donkey who talks very slowly and is always sort of thinking of the worst of the world. And certainly those aspects can come up in teen depression. Many teens think poorly of themselves. You can see slower movement. You can see kind of lack of energy. But teens don't always show that the way that adults do. Sometimes you can see irritability. That's a pretty significant difference in adult depression versus child's or teen depression. And so you have irritability that can also sometimes look like anger. If teens have other additional psychiatric illnesses, sometimes you can have actual aggression associated with it. So it can just appear not quite the same that adults think of when they're saying, okay, well, this is exactly what depression looks like. And teens aren't necessarily going to show it the way that an adult would, especially to their parents, right? We know that teens tend to be very good about trying to cover things up. So it's always worth parents for taking a step back and trying to give the kid the benefit of the doubt and recognizing that, they can still be depressed even if they don't look like they're depressed. There's depression afoot.
Yes. And I think that's such an important point, that depression can look different in teens and children than it does in adults. And I think particularly with teens and preteens, oftentimes parents attribute some of the changes that they might see to puberty. And, oh, that's just, the tween stage, that's just puberty. And depression might be missed in teens. Or they may explain some of the behaviors. They might say that, oh, that's emotional dysregulation related to their ADHD. And again, miss a depression.
Absolutely. It's so easy for parents who definitely want to assume, their kid isn't depressed. No parent wants their kid to be struggling or to be depressed. And with depression comes some very scary thoughts about your child. Like, what if they start having thoughts of not wanting to be alive anymore? And so I think it's very understandable for parents to want to say, oh, this is probably just normal adolescence, or this is just, their ADHD sort of flaring up in a way, or this is social media and they're spending so much time online. It's definitely what they're seeing online. But that's a dangerous trap to fall into, because it's then prevents parents from reaching out and seeking help. I mean, again, going back to, this is not the parent's fault. So making sure that they feel comfortable reaching out and accepting that if their child is depressed, the most important thing is that both the parent and the child get help for that and figure out how to tackle it, and kind of with a system to help them, rather than denying that it's there.
Right. And many parents might be even surprised to learn that depression can manifest as physical symptoms, headaches and stomach aches. You talk about that. And how does that happen? And, parents often don't recognize or maybe even attribute it to anxiety or a real stomach ache. They're just not feeling well physically.
Yeah, we know that there is a significant amount of children who present with what we call somatic complaints, like headaches and stomach aches when they're depressed. Kind of going back to what I said in the beginning, right? Depression is an illness that impacts your entire body. I think we frequently will say, oh, it's just of the brain. And certainly that, is predominantly kind of where the diagnostic criteria come from and how it impacts the brain. But as I say in the book, your brain hopefully is attached to the rest of your body. And so the rest of your body will feel something.
Yes.
And that's not unreasonable when we think about all these other illnesses we have that might be other inflammatory conditions where your body can have chronic pain or stomach aches or headaches. We know that there are so many chronic medical illnesses that also have depression as a part of the illness or a symptom of the illness. So it's also so important for parents to make sure that if their child is having physical symptoms that are impairing them, both definitely seek out medical attention to make sure there is no kind of different medical illness that is being missed, or I guess non-depressive illness that is being missed. But then also to have an open mind that if everything else comes back negative, it could potentially be an illness like depression.
Yes. You mention in your book that depression has gone viral. It's actually the title of your book. Can you talk about what you mean by that? And I know that we've also talked about how social media might be influencing how teens understand and discuss mental health, but that viral piece really stands out to me.
Yeah, certainly, there's the play on words that, virality is something we refer to as a construct that kind of goes I guess everywhere and spreads everywhere very quickly and kind of has a contagious element to it on the internet. And the book is really focused on how digital media can potentially impact depression and all areas of the illness and the course of the illness. But the internet and social media platforms in particular have also introduced some very, at least to me, kind of unexpected goods and negatives about the exploration of one's psychiatric illness online. And on the one hand, there are now far more opportunities on the internet for teens to connect with others about their psychiatric illness. And I think certain influencers and celebrities have also done a very good job of trying to be open about their own treatment for mental illness in such a way that we can try to make some headway in what is often a very stigmatizing illness. So that's definitely a wonderful part of the kind of virality of mental illness online. But also there have been many aspects of treatment for mental health that have sort of gone viral in less constructive ways in terms of thinking about, for example, most recently, right? We have now had an influx of panic almost about SSRIs and their treatment of depression in light of RFK Jr.'s stance on SSRIs. Absolutely, I will never, and I say this in my book, I will never say that SSRIs or medications alone are the only treatment for depression. In child depression, that is just not how we move forward in treating the illness. And it's not constructive to only try medications. We really want to try a more holistic, comprehensive approach where we're having lifestyle changes and therapy and then medications if absolutely needed and there's severe symptoms. But we do have enough evidence at this point to suggest that they are not as addictive as heroin, as has been spread around currently, and that they are efficacious, especially for teens who have moderate to severe depression symptoms. And unfortunately, because so many news outlets have been picking up these stories and they've been spreading like wildfire, there's now been, and I've seen this sort of anecdotally in the kind of mental health professional groups on social media, a whole host of individuals who are now saying, oh my goodness, I need to get off these immediately. And so it sort of then has to kind of bring all the practitioners back to saying, okay, how do we tackle this? How do we come up with a unified response? How do we encourage people to connect with the accurate information? How do we present the accurate information in a way that people will be receptive to it? And so again, there are great parts about depression treatment and depression, I guess, connection with others who have depression, right? And understanding mental illness online, but there are also a lot of negatives and the virality of it. And certainly, because the worst case scenario, and I mentioned this in my book, is that there are also sometimes teens that will explore more dark aspects of their symptoms on the internet as well. And we know that suicide content in particular can have what's called kind of a contagion effect. There are very specific ways that we are supposed to talk about suicide, that news outlets are supposed to talk about suicide, because the way that you talk about it can influence whether a person may act on the kind of suicidal urges or seek out help. And unfortunately, social media platforms are not subject to those same rules. The content is created too quickly and there's no oversight. And so even children who are going online to try to find an outlet for either the depression symptoms or to learn more about depression or even suicidal ideation can unfortunately encounter some incredibly dangerous information. And so there just so many different ways that youth may want to engage with the internet and information that has gone viral about depression, but they do have to be very careful, and the parents have to be very careful about what their children are accessing.
I am going to take a short break to tell you about one of our Child Nexus partners, Pacific Preparatory, which is now enrolling. Pacific Preparatory is an accredited K-12 private school offering one-on-one live virtual instruction. Unlike any other school, Pacific Prep builds a truly customized curriculum for each student as opposed to adapted preset programs. With over 20 years of experience, the innovative model is tailored for today's families. Explore top-tier academic programs available for full and part-time enrollment designed for students with complex learning differences and mental health challenges. Expert tutoring, executive functioning coaching, and test preparation is also available. Ready to learn more? Discover more at pacificpreparatory.org. Now back to our conversation. That can be very scary to parents, right? I think there's enough information out there to show that social media can, exacerbate mental health issues in children and teens. And we also know that teens, like you were saying, find support in online communities, but they can also fall into these, what you're describing as toxic echo chambers that reinforce the negative thoughts that they have. How can parents help their kids differentiate between helpful and harmful digital spaces? Because I think so many parents kind of put their hands up in the air and say, there's nothing that we can do, or feel limited in terms of what they can do. They want their kids to develop a healthy relationship with technology without completely banning it.
Yeah, that's a great question. And I think that because of how scary that content feels, there is absolutely a desire to just cut a child off from that sort of content and to ban social media. I do think that when a teen is engaging with suicide related content specifically online and not for the purpose of necessarily finding help, but for suicide planning, that would be an instance where I would recommend that that child should not have any unsupervised social media access moving forward until they are at a safer space. But that being said, you're right. Like for children who are trying to understand their illness and maybe do have suicidal ideation, but are looking for help or an outlet to understand how they're feeling or wondering if other people feel the same way as them, the internet can be a helpful place. And this goes back to how do we talk to children and teens about the internet? I think that we are spending so much time trying to react to, and I mean, again, we as scientists, researchers, clinicians, trying to react to the challenges of the internet that have already sort of happened, that we haven't put as much effort into figuring out how systematically we can implement changes much earlier on before crises occur. And so one way would be improving children's digital media literacy, and not just, knowing how to use the internet and social media platforms, because most teens, my 3-year-old at this point could probably use the internet better than I can. It's incredible how fast they pick things up. But they don't necessarily understand the motivations of the platforms or why platforms might word things the way that they do, or use what's called short form videos in order to keep people engaged and sort of trap them on the platform for longer. They might not know about the algorithms that hopefully will be banned for teenagers or under 18s moving forward. But again, it's unclear how successful that ban will be, and children certainly have been able to get around age limits elsewhere on the internet. So really, again, going back to the basics of just teaching children how the internet works in an age-appropriate way, and how they need to be really in touch with themselves in the use of the internet. I often tell parents, there aren't children for whom the internet or social media is all bad all the time, and you should never have access. And there probably aren't teens for whom the internet is never going to cause a problem, or social media will never cause a problem, right? It's more about where that child or teenager is at that time, and all of us sort of understanding our own relationship with social media platforms. So thinking about times of day, or even kind of the times of illness, right? If a depression is at a more kind of dangerous level and the symptoms are more severe, that would probably not be a good time to be visiting suicide related platforms, right? And so children just knowing, when it's 2 or 3 a.m., if they're online and exploring these platforms. And that is a time when many teens and adults can have some really dark thoughts crop up because there just isn't as much to distract them, and there aren't people, around in the house, knowing that is a hard time for them. And so that sort of content, accessing that at that time can be incredibly dangerous for them. And so in the book, I mentioned, creating safety plans that can help the teen and the parent understand what can trigger symptoms and make them worse, or what are really significant warning signs. And so those sorts of, aspects of awareness of internet use can be incorporated into a safety plan, so that parents are aware and teens are aware that when I start doing this is a really bad sign. And I think that will, at least for now, and unless we somehow successfully manage to ban all of this, will be the best way for us to help teens moving forward. And again, I don't want to say that I'm encouraging the banning of social media platforms. I also don't know that we have enough evidence to say that teens shouldn't have any access to social media platforms. But like with driving, right? We don't let teens just have the keys to the car and say, okay, hope this goes well for you. I'm not going to teach you how to drive, but you can probably do it, right? We don't do that. So we have to think the same way about social media platforms and the internet, and helping teens learn how to use it responsibly with our guidance and supervision, so that then they can be confident that they know how to do it safely once we're no longer there watching over their shoulder.
Yes. I mean, you've talked about safety plans, which are such an important part of the overall treatment plan for adolescents who are struggling with depression. Can you talk about effective treatment? So if a parent is listening and they're saying, I really suspect my child is depressed, or teachers might be concerned enough reached out to parents and said, I'm concerned about your child's mood. Can you talk about effective treatments for teen depression?
Yeah. So I think about treatment for depression, kind of the optimal treatment for depression, as a three-legged stool, where if you only have two, or certainly if you have only one leg of that stool, it will not work properly. You really need to have all three components working together in order to treat depression. And admittedly, that can prove tricky at times, right? If your child doesn't want to take any medication and is absolutely refusing to do so, or if their sleep just cannot be fixed at all, to the point where they're sleeping, only 1 hour a night, or they just won't eat, right? There are things that we know children with depression tend to be more likely to do, like sleep less and eat more poorly, not go and move around as much, kind of stay indoors, right? Those are things that they can try to counteract, but it's challenging. It's hard. And so while we would love to say exercise and a good diet and better sleep can by themselves fix depression, we don't have evidence to prove that that's true yet, especially in teenagers. And then, of course, right, when the teenager is feeling quite depressed, they are not going to want to exercise or potentially even eat at all. And their sleep can be very, I would say, wonky, for lack of a better word, and just often insomnia or early waking. So in those cases, we say, okay, we really would encourage that when your child is depressed, start out with making those lifestyle changes, but also putting therapy on board as well. There are two evidence-based therapies, cognitive behavioral therapy, which you might hear as CBT. There's also interpersonal therapy, IBT, which are kind of the most recommended therapies. They're kind of short-term protocols specifically for the treatment of depression in teens, which is great. But that being said, other therapies can be helpful as well and have more evidence behind them, I think, than sometimes is admitted, that they can be, a way to help teens feel better about themselves and to start challenging some of those negative thoughts. So that's the best place to start. And then when teens are having moderate to severe depression, at that point, most clinicians will say, okay, we really should consider a medication. And that most commonly is going to be a SSRI, a selective serotonin reuptake inhibitor. The long words, that's less important, as it's frequently referred to as SSRIs. And there is good evidence for them being most helpful in moderate to severe depression. And again, not alone, best in conjunction with therapy and with trying to make sure that sleep habits and eating habits are improved and optimized.
Yes. And when you talk about that moderate to severe depression range, a lot of parents become concerned when their teens are having suicidal thoughts. You mentioned suicidal content on social media and other platforms. Can you talk about the difference between suicidal thoughts and non-suicidal self-injury? Because that comes up for families a great deal, and it's hard for them to understand the difference between those things, suicidal behaviors even, and non-suicidal self-injury.
Yeah, absolutely. So non-suicidal self-injury, you may hear online especially, or amongst other parents or kids, referred to as most commonly cutting. That's an incredibly common form of self-injury. Non-suicidal self-injury is really the act of harming oneself without the intent to end one's life. And certainly, I want to emphasize that teens who engage in non-suicidal self-injury can definitely also have suicidal ideation. So I don't want to say that if a child is engaging in non-suicidal self-injury that they do not also have suicidal thoughts. That is absolutely not true, but children can also have suicidal ideation, but not engage in non-suicidal self-injury. So it's important, it's very important that you brought up that question, and that they are different things. Non-suicidal self-injury has been studied extensively, and I think we're still trying to understand, for every teen, there can be maybe a different motivation, and sometimes an even unconscious motivation to engage in it. Sometimes there are sort of social situations that teens might realize that cutting themselves or injuring themselves in some way helps to kind of remove them from that situation, or maybe to bring about attention from a loved one, which I think is one of the most common misconceptions that parents have, is that they're only doing this for attention. It's all for attention. Yes, that may be true, but sometimes that is not even conscious. A child is not even aware that that is an association they've made in their minds such that they know they need help. And this is their way of communicating that they're in such distress and they need help. So I really encourage parents to try to take a deep breath and recognize that, yes, it's frustrating. It can feel manipulative in a way at times, but that really their child is trying to manipulate them in a way to just say that I need someone to help me right now because I don't know how to help myself. I don't know how to regulate the way I'm feeling and make those feelings go away. And this is the only thing I kind of know how to do. Other times, some teens say that they feel numb when they're depressed, and so that they injure themselves in order to feel something. Sometimes teens say that they use self-injury as a way to distract themselves from their depressive thoughts or even from suicidal ideation, which can seem incredibly confusing to parents. But even though non-suicidal self-injury is always something that we want to caution parents about and take seriously, it doesn't always mean that the child does want to end their lives. And certainly the act of injuring oneself doesn't necessarily mean that that was an attempt on one's life either.
Mm-hmm. And, you really highlighted the idea that this could be a call for help, that there's some distress that the child is experiencing. And whether it's suicidal thoughts or non-suicidal self-injury, they both warrant attention and, connecting with a professional who can help kids, teens, families navigate some of these thoughts and behaviors.
Mm-hmm. And parents, again, because they're absolutely terrified, I think have a tendency to want to say, okay, just don't do it anymore. Right? Just stop cutting yourself. I don't want to see that ever again, because of course they're terrified. But unfortunately, for many teens, especially if they have learned how to cut themselves as a way to make themselves, as weird as it sounds, feel better, and they've learned that as a coping skill, it's an unhealthy coping skill, but it is a coping skill. It can be so difficult to stop engaging in that behavior when they feel distressed. And it does take a lot of intentional effort and time to relearn new, healthier coping skills to manage those urges. And unfortunately, when then parents say, but you can just stop it, right? Just don't do it. And then kids do end up injuring themselves again, or maybe they go for a couple of weeks without injuring themselves and something happens and they injure again. Parents can sometimes then react very strongly and children feel very shamed. And then shame can bring about worsening depression and unfortunately kind of a vicious cycle. And then they may self-injure more or feel like, I can never stop this. Who am I kidding? I'll just continue. And that's a very dangerous road to be on when the child just no longer thinks that they have any ownership or ability to help themselves, because we really do need them to be engaged in treatment in order to tackle depression and in order to tackle non-suicidal self-injury.
Yes. And that treatment piece is really critical. You've also mentioned, practical lifestyle changes that can help buffer against depression in teens. You talked about sleep and exercise. Mindfulness can work as well. Are there things that parents can do at home to create an environment at home that fosters emotional resilience?
Yeah, so this is going to be maybe a weird first response to this, but I actually think one of the best ways that we can foster emotional resilience in teens is improving their sleep. I
agree with you.
I know. That's a good, because I personally have no emotional resilience when I'm sleep deprived. And it's something I first learned when I was doing call as a resident and in medical school. And then once I had children and you're going for longer stretches of time not sleeping, you realize, wow, just my bandwidth is it's really small right now. And that's exactly the same thing for teens. And it's even harder for them because their brain's brakes aren't really working the part of their brain, the prefrontal cortex that helps them not act on things that would be dangerous or impulsive. It doesn't really become optimized until your mid to late 20s, depending on a biological sex. So you end up, if you are already feeling like you're overwhelmed, feeling even more overwhelmed even faster when you're not sleeping, and then potentially doing things that are really bad decisions like self-injurious behavior or substance use, just more prone to making risky decisions. And so I think that tackling sleep, if there's any lifestyle change that parents should really focus on helping in the home for teens with depression, it's sleep. And I guess that sounds weird as like a household thing, but I do actually think it's sort of a kind of a overall household approach that is necessary so that the teen is help to recognize that they're in an environment that is conducive to sleeping, and they have a nice chunk of time before bedtime with no screens, with no activating noises. The parents can help them by making sure they're not bringing up really challenging topics right before bedtime or things that are going to provoke an argument right before bedtime, right? And helping a kind of predictable routine get into place. No, as I said, no screens in the bedroom. Finding ways that their teen can just try to improve their sleep first and foremost. And sometimes that may come down to medications if a teen has really significant insomnia. But there are many behavioral strategies that can be tried first. There's CBT, which is cognitive behavioral therapy for insomnia, that really focuses on how to kind of optimize sleep habits and sort of like sleep train oneself after childhood. And that can be something that parents can implement even for many members of the household at the same time. I also think that the way that families approach screen use in general is important to reconsider when a child is depressed in the home, because we know that teens who are depressed are more likely to want to go on their devices and just scroll. It's a way for them to distract themselves, but also a way for them to potentially engage with others and feel good about themselves when they just don't have the energy to do anything at all. When a child is depressed, I think parents want to be open-minded and say, okay, that's their coping skill. That's what they need right now. But again, the more time you spend on those devices, you're risking not engaging in other activities, lifestyle changes that we know can benefit depressed individuals, like exercising and predictable life routine structure, sleeping. So I really think that if the parents say, hey, we know this is a really tough time for you right now, let's find ways as a family that we can get off devices and really engage with each other, even though teens sometimes don't like that, but modeling that the parents are also willing themselves to set limits on their own screen use, so that the child can take advantage of some of those beneficial activities. That's a really important thing for families to consider, because you can feel so alone when you're depressed. And if everyone in the family is still on their device and the parents are saying, well, you're depressed, you can't use your device, but we're still using it in the wee hours of the night as well. And that's just an incredibly isolating feeling for teens. And so it really helps the teen understand that this is the family together trying to help them. And that's a very validating, important feeling for the teen to have.
Yes, it's really a family approach to intervention. Dr. Gansner, thank you so much for sharing your expertise and for giving parents, educators, and clinicians guidance on how to support teens who are struggling. Your book is now available, and I'm highly encouraging our listeners to check it out. I'm going to put a link where you can purchase it in the show notes, and there is a 20% discount if you purchase before March 21st, correct?
Mm-hmm.
Yes. Okay. And so make sure that you check out the show notes, because there will be a link there for you to purchase it. Again, Dr. Gansner, thank you so much for being here.
Of course. Thank you so much. This is wonderful.
Thank you so much for joining me for this conversation. And for listeners who want to dive deeper, Dr. Gansner's book is now available, and you can purchase it at a discount using the link in the show notes. Thanks again for listening. If you found this episode helpful, please share it with someone who might benefit. And don't forget to subscribe so you never miss an episode. Until next time, take care and be well.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.